The island of Puerto Rico has 4.5% of the nation's population under poverty levels, but receives just 0.13% of medical funds.
In Puerto Rico, we have 44% of the population lives on the poverty level. And in Puerto Rico, we receive $30 per month per participant from Medicaid. In the States, people in the States receive $330.
Oh, really?
Puerto Rico right now receives between 17 and 22% reimbursement for their Medicaid expenses. A state like New York, for example, receives 50% reimbursement. Tennessee, Mississippi, and other poor states receive a higher percentage, which is about 83%, which is the maximum. Because Puerto Rico receives only between 17 and 22%, it becomes a burden for the island and the budget that we have in order to provide those services for those Americans living in Puerto Rico.
The inequalities facing residents of Puerto Rico have naturally resulted in a larger number of health-related incidents.
Well, Puerto Ricans and Latinos as a whole, we have one of the highest incidences of diabetes, high blood pressure, and many chronic diseases. And just that alone, and heart disease, and just that alone means that health equity is so important in our community, and access to health is so important in our community. Our governor has always made a commitment to that.
Now that Congress is drafting a legislation for healthcare reform, Puerto Ricans are asking the administration to be fully included and end the disparities by providing equal funding to the island.
Our objectives, our goals are the integration of Puerto Rico in the 2009 federal healthcare reform, and second, the parity for Puerto Rico on the federal healthcare program, specifically Medicaid, Medicare, and CHIP. Those are our two goals.
Our recommendations are that whatever programs they are giving to our citizens in the United States, it should be as equally given to the citizens in Puerto Rico. Doesn't matter where you live.
These Americans that live in Puerto Rico should not have to travel to states like New York, Connecticut, Pennsylvania to receive this healthcare treatment. That should be provided to them in the island of Puerto Rico or in the territory of the United States that they reside. We want equal treatment, and for those 4 million Puerto Ricans in the island to be treated equally to the rest of the nation. When they send funding to Puerto Rico, it should be at par with the rest of the states. It is a shame that Puerto Rico receives less funding than Mississippi and Tennessee.